Today, we are going to take a close look at being a doctor.
In my career, and there's certainly cases that I think will stay with me, well, that I hope stay with me forever, where I feel.
Can we talk about salaries in medicine?
I also feel sort of really proud working for the NHS at the moment.
And don't be disheartened if you don't get in the first time.
Today, we are going to take a close look at being a doctor. We'll be looking at what being a doctor actually involves, the routes to becoming one, and hear real stories from 3 doctors, all practicing in different areas of the profession. They'll be giving insights into what life is like as a doctor, sharing with us their personal stories on becoming one, as well as giving practical advice which you can apply to help you on your own career journeys. So now let us meet them. Can you please introduce yourself, guys? Charlotte, let's start with you.
So hi, I'm Dr. Charlotte Jenkins, and I'm a paediatric registrar working in London. So to get into medicine for my A-levels, I did chemistry, biology and geography. I then did a 5-year medical degree at Bristol University. I've worked for the NHS for about 7 years, and I've also done 2 years working as a paediatric emergency medicine doctor in Brisbane, Australia.
Superb. Harriet, can we go to you now, please?
Yeah, so my name's Dr. Harriet Kiddy. I'm a GP working in North London. For my A-levels, I did biology, chemistry, physical education and French. And then I went to Bristol University and I did 6 years there. So as well as doing my medical degree, I did an intercalated degree and got a BSc in bioethics. I then went straight to foundation training in London and then on to GP training, which I finished 2 years ago. So I've been a qualified GP for the last 2 years.
Nice. And Charlie, do you want to introduce yourself, please?
Yeah, I'm Dr. Charlie Loveday. I'm an elderly care registrar on the South Coast. So my background is I did my A-levels in chemistry, biology and history. Went to university for 6 years, did a BSc as well as Bachelor of Science. I then did my sort of first couple of years on the South Coast. Similar to Charlotte, I went abroad after that for a year in emergency medicine. And I've been in elderly care training now just in my 3rd year.
Superb. So I think what's really advantageous to having the selection that we have here are that we've got 2 hospital-based doctors in Charlotte and Charlie, and Harriet, you're community-based. You're a GP, so you're not practicing within a hospital, but obviously you're integral to sending patients to hospitals to receive the correct treatment. But we'll go into that in a bit more detail. So I think the first thing it's interesting to know, and Harriet, can you take the lead here, is how did you decide that you wanted to be a doctor?
So my mum was a nurse working in a GP surgery. So it was always something at the back of my mind, thinking about going into medicine. And then as I went through school, I really enjoyed the sciences, and when it came to picking my A-levels, I'd always thought that going into medicine and studying that at university was what I wanted to do. And I'm a real people person. I really enjoy being around people, with people, and it sounds like a bit of a cliche, but helping people, and actually every day I do feel like I am able to make a difference to people's lives, and I really enjoy my job.
I think that for me, I was just good at sciences at school, and it was one thing I enjoyed. So biology and chemistry are things I was sort of quite good at. And I think that it's interesting. Everyone has a different reason, but I've been doing a little bit of research, and actually the General Medical Council last year did some sort of a survey of doctors, sort of reasons they went into medicine. And actually, the thing that came out at the top was sort of I enjoyed studying natural sciences. And sometimes it's just what you enjoy doing at school, and actually job security, and there's always going to be a need for doctors. And then what really cemented it for me was doing some work experience at school. So I did 2 weeks at a hospital and really enjoyed that team environment and looking at x-rays, looking at bloods, and that sort of cemented and made me then want to go in and do it as an undergraduate.
What does the day-to-day life and what does your day-to-day look like, Charlotte? Do you want to start us off on that, please?
Yeah, so my day-to-day will vary hugely on where I'm sort of allocated to work that day. So as a paediatrician, we work across a number of different areas. So one of those being the neonatal intensive care unit, where we care for premature babies. I could be allocated to the paediatric ward, so looking after children up until the age of 16. Sometimes we do clinics, or I could be down as a paediatrician based down in the accident and emergency department. So wherever I'm based, every day starts with a team handover. So all of the night team and everyone for the day, we sit down, we normally have a coffee and talk about the patients and work out what our kind of goals for that day are with regards to each patient. Then if I'm in A&E, myself and a junior member of the team will be working together throughout the day. That day is really, there's no real structure to that day because one case can take up your whole day if it's something significant. But you have a few responsibilities down there. So one is that I take calls from local GPs who are concerned about children, and we'll make a plan about whether they need to send that child into hospital to come and see me or not. I'll also take referrals from the A&E team. So the A&E doctors working down in A&E, if they're worried about anything or need help with anything with a child, they'll call me and I'll go and help them. But probably the biggest part of my day when I'm covering A&E is that I would be the team leader for any resuscitation calls that come in. So any emergency calls from ambulance crews or any sort of very sick children elsewhere in the hospital. And that's kind of what you see a lot more on TV. So lots of bleeps going off and lots of people running.
And Harriet, can you take us to the role of being a community-based doctor and being a GP?
Yeah, sure. So I'm what's known as a portfolio GP, which means I don't just work in my general practice surgery. I do a few other things on other days. So I work 3 days a week in the GP surgery. And that is, I start my clinic at 8:30 in the morning and finish about 12:30, and normally see 16 patients and have 2 phone calls. And then at lunchtime, we'll end up doing a lot of paperwork. So we get letters sent back from the hospital clinics where our patients have been seen by doctors in the hospital, or discharge letters where they've been admitted into hospital. So the doctors are writing to us and letting us know what's happened, any changes to medication, monitoring we might need to do. We'll also have a look at blood results. So if we request bloods for our patients, they come back to us. We'll also be signing a lot of prescriptions, so patients on repeat medication or new medication that have been started by the hospital. And then my afternoon starts about 2:30, and again I'll see 16 patients and have 2 phone calls, and it normally finishes about 6:30. So on the other days, 1 day a week in the practice, I'm a GP tutor for medical students at UCL. And then my other portfolio roles are, I'm a GP for the eating disorders unit at the local mental health trust. So in the morning I do a ward round of the patients that are admitted to the eating disorders ward. So it's quite varied. So I've got a mix of clinical work and then 1 day of non-clinical work.
What's interesting for you is that presumably you have no idea, again, what the problem is that the patient will have, and you have to try and diagnose what's wrong with that person. Is that so? So when someone walks into your room, can you talk us through that process really quickly?
Yeah, there's a lot of patients that I know and I expect to see sort of every few weeks or months. But then there are patients that I've never met before, because we're a huge teaching practice. We've got a list size of nearly 20,000 patients. So, there are bound to be plenty of patients that I've never met before. And they all book into a 10-minute slot. And most of the time I have no idea what they're coming in for. And I love to chat as well. So it's very difficult keeping the 10-minute time limit.
I know the problem.
Yeah. So you've got to work out why they're here. Often patients have an idea of what they want out of the consultation or what they think is going on. Sometimes it's correct, but you've got to sort of decipher what's going on, work out what you're going to do about it, and then get them out the door in 10 minutes. So it's quite
Google must make your job a nightmare now, right?
It is, yeah. Everyone's got an opinion. So yeah.
Can you just give us an overview of the routes to becoming a doctor? And Charlie, can you talk us through that one, and others chip in as you see fit, please?
Yeah. and I first of all would say to your students, there's a very good website, direct them to, called medschools.ac.uk, which does a very good broad overview of the different courses and also different grade requirements. But broadly speaking, sort of minimum A-level requirements would be 2 A's and a B, with compulsory chemistry plus a science. As I said, different universities have different grade requirements. And broadly speaking, of once you think about your A-levels and what grades you need, there is an entry test you have to do. There are 3 main types. For people that are doing medicine as a postgraduate, there's something called GAMSAT. There are 2 others for undergraduates, for undergraduate degrees. The first one is BMAT, and the second is UCAT. So if you've achieved those requirements, you would be, and the next stage you need to go for an interview. Different universities do different interview setups. So broadly speaking, so there's your standard entry medicine, where you do your A-levels, you achieve your grades as set up by the university, and you enter as an undergraduate into a 5-year course. The next way of doing medicine is you can do an undergraduate degree in another subject, and then do a postgraduate medical degree. Generally, the postgraduate degrees are shorter, so 4 years. Right. The other route to medicine was a 6-year course, where you may have not done the A-levels, science A-levels, but you have a lot of the attributes and to actually be a really good doctor, and they will do a foundation year to get your sort of science level and build on certain principles in the medical curriculum to then get you to a point where you'll then can enter the 5-year course.
What skills do you need to have to succeed at being a doctor?
So, I mean, I think it varies a lot between different medical specialties, and different skills and also different personality types will suit different areas of medicine. So we all work in fairly different areas of medicine, actually, and we'll all have sort of aspects of our personality that suit that area. And you don't really know that until you start working and kind of work out what team suits you. But I think there are probably a few things that you need across the board. So the first is probably that you need to be quite committed. So medical school is quite long. At times it's quite difficult. And, even after you qualify medical school, you've still got, years of exams ahead of you and things like that. So you definitely need to be somebody who's quite committed. And also sort of going forward, when you become a doctor, you'll work on rotas that you won't necessarily get the time off that you want, and things can be a little bit difficult. So you do need to be quite committed to that career path. We've all said it a few times already in this, you need to be a really good team player. We all work in teams, and not just with doctors, but with sort of nurses, physios, loads of different sort of healthcare specialties. And you need to be able to sort of communicate and work well within a team. And then I suppose the last one, which I think is really important in most specialties across medicine, and that I suppose is something that you can't learn. It's something that's quite inbuilt, but I think you need to be quite an empathetic person. We deal with people at sometimes the worst times of their lives. We see them at their most vulnerable, and you need to be able to feel empathy towards that and respond to people in those situations.
Now going to move on to what you like most about being a doctor, and is there any particular peak experience you've had whilst being a doctor? And can I direct that question to you, please, Harriet, to start with?
Yeah, so I think for me, what I really enjoy is working in a team environment. So I did worry going into general practice that it would be a bit isolating and lonely, but actually I work in a huge training practice. So we've got sort of 15, maybe up to 20 GPs and lots of GP trainees around, but also nurses, allied health professionals, and all the reception and admin staff. So it is a really buzzy environment and a great place to work. But also there is, you're seeing a new patient every 10 minutes. So there's always someone to talk to. And it's a really nice job. You get to have a real impact and a positive impact on people's lives every day. Even if it's just, I'm not necessarily saving lives every day, but I'm making a difference to people's lives every day.
Sure.
I think some peak of my career, it's not that the gifts mean anything, but it's really nice when a patient, I've got a patient that makes me shortbread, someone that brings me plants, and it's just really nice when someone acknowledges your work, and that you are actually having a positive impact on their life. So that really helps.
We're going to move on to Charlotte. Can you tell us about what you love about being a doctor?
Yeah, so I think I'm really happy that I chose the specialty that I did, and I really love being a paediatrician. I really like that my day is really varied. No day is ever the same, and I don't really know what to expect when I go into work in the morning, which I quite enjoy. I really like with paediatrics, I don't just work with one patient. I have the patient, but then their whole family on top of that as well. So sort of dealing with lots of different people throughout my day. I've had loads of, I suppose, really great individual experiences in my career, and there's certainly cases that I think will stay with me, that I hope stay with me forever, where I feel like things that we've managed to get a really good outcome for that child and their family. But I think, again, we talked a lot about teamwork, but at the moment we're currently in the middle of the sort of COVID-19 pandemic. And even though that's been a really difficult time to be a doctor, I think it has brought out a lot of what is really excellent about being a doctor. It's been sort of like really great seeing how people across all different types of medicine sort of all have come together to work as one big team to kind of sort of like rise up to the challenge. And even though things are quite hard at the moment, I also feel sort of really proud working for the NHS at the moment.
I think that's being echoed nationally. These 8 o'clock applauds that we got to step on our doorsteps and applaud you guys. I think it just shows how fundamental you are to the functioning of our society. Charlie, do you want to give your what you love about the job as well?
Yeah, I think that so I do elderly care, and I mean, first and foremost, I love spending time with people that have had long, interesting lives. I mean, a lot of my time actually is just spent chatting to people and saying, what was it like during the war? What was it like as a child in the 1930s? Just really interesting conversations you can have with people, and then you can go on to actually the making a diagnosis and treating them. The other thing I like about being a doctor is that I always feel that I'm professionally moving forward and developing myself. So you're not just developing yourself as someone that can make a diagnosis. You're developing yourself as a team member, as someone to lead projects to improve patient care in hospitals. You are professionally developing your knowledge through postgraduate exams. And every day I go in, I feel I come home at the end of it having developed myself as a doctor a little bit more. And I think that is a unique aspect of being a doctor. And do you know what? It's just really good fun, particularly what Charlotte was saying about in this current crisis. When you're in a sense of team, we've really pulled together in this crisis. And actually, I look forward to going to work and being with my colleagues, with the nurses, physios, HCAs, the ward clerks. Everyone is just really good. It's good fun to be in that team setting. So that's probably what I like the most. In terms of a peak for me, what I like also about being a doctor is you do get to go abroad to things like conferences and go and present your projects in different countries. And for me, one of my peaks was presenting at a national conference in Berlin in Germany on a study I did on virtual wards in the community to prevent elderly people from going into hospital. And that was quite a proud moment for me. So that's probably my peak.
Brilliant. Talk us about this. Is there anything for any of you which has been quite difficult and that you've had to overcome Who would like to start us off there, if possible, please?
So yeah, I can say something. So I think, so as a paediatrician, I sort of deal with quite difficult situations, like involving children who are sometimes, unfortunately, very unwell or may have a life-limiting illness. That can be really, really overwhelming at times, and that can be quite difficult to deal with. But I think there's a few ways that kind of help you overcome that. The first is that throughout your medical training, you will get loads of support and loads of assistance in building up resilience, essentially. So how you deal with these and how everyone deals with situations like this will be very different. For me, I always try and leave a situation like that and want to feel that I feel I have done my best. And even if that's not necessarily the outcome that we wanted, it's the best that I could do for that patient and their family, and feel like you've done everything that you can. But also, and I'm sure Charlie may have a view on this as well, but also sometimes these situations are actually where you can make the biggest difference to a family, even if it's not an outcome that you would necessarily want. The way that you guide that family through it and the way that you behave as a doctor can make a really long-lasting difference to that family. So I think there's a lot to be gained even out of really difficult situations. But the main thing for me is that I always try and leave work at work and not bring it home with me. Otherwise it can all become sort of really overwhelming.
Sure. Anything else to add, guys? I appreciate it's not the easiest of questions.
So yeah, in terms of, you know, the patients that I look after are, some of them are coming to the end of their lives, and there are, you know, one of the challenging things is the ethics around end of life decisions and best interest decisions, particularly people that lack capacity. So when I say, what I mean by capacity is having the ability to take information in, weigh up the pros and cons of a certain treatment or a certain way forward, making a informed decision about what that person wants to do. And part of my job is almost taking on that decision-making role with a patient's next of kin about what's in that patient's best interest going forward. And particularly in elderly medicine, it's when to do certain investigations. Are those investigations appropriate? And sometimes there can be conflict in that, and that can be very, very challenging.
Just building on that, is there anything that you wish that you'd known before joining the profession that would be useful at all?
I think medicine is even when you finish university, the learning doesn't stop. It is a career that involves lifelong learning and reflecting and then developing your skills based on that. So, you know, you might think, oh, after medical school, that's, you know, I've done all my studying and I'll start working. But actually, even when you start working, you're learning so much every day. I probably learned far more in my foundation year than I did at medical school, just of the practicalities of doing the job, what being a doctor really involves, and how my career might look in the future. I think until you're in it and doing it, you're not really aware of all that stuff. And we have loads of exams as postgraduate students and doctors, and lots of reflecting on our practice as well. So yeah, that knowing that that's going to carry on is important, I think.
Can we talk about salaries in medicine? And Charlotte, do you mind talking us through that one?
Yeah, so I mean anyone can Google these values, so there's nothing really to hide, but I think how doctors get paid can be a little bit complicated, and the values that you see if you Google it, for example, are not necessarily reflective of what you actually get paid. So I can kind of talk through how that works a bit. So pay is based on two things. So your level of experience, but then also how many out of hours shifts you work, and out of hours shifts will count as evenings, weekends, and night shifts. So if we look at the kind of basic salaries, so your first year out of medical school, so as a foundation year one doctor, your basic salary is £24,000. And that sort of gradually increases in increments until your kind of base salary as a consultant is £80,000. But just to kind of put that into context, so what I work at the moment, so for the level that I work, my basic salary is £48,000. I work about 1 in 3 weekends. I work a couple of evenings a week, and I probably do 3 or 4 night shifts every month. So even though my base is 48,000, I earn probably an extra 50% on top of that, just based on the number of out of hours shifts that I work. And that will vary between different specialties and how sort of heavy that out of hours time is. Pediatrics is quite heavy on out of hours.
Sure.
So that's probably towards the higher end of extra earnings. And then your final salary, so when you're kind of when you're a consultant, will be again really heavily based on what specialty you work in and whether you work in hospital or the community. And there are different earning potentials in each. And then obviously we talk a lot about the NHS, but a lot of specialties will also offer a significant amount of private work, which you can obviously boost your salary quite a lot with that.
Fine for that. So we're now going to move on to work experience. Charlotte, can you talk, work experience presumably is something you would advise students do?
Yeah, definitely. But all work experience is useful, but it can be a little bit challenging to get work experience in hospitals. So I don't know if you guys would agree with that. And obviously it was quite a while ago that I did it, but even then it was a little bit of a challenge because obviously you can't just have a load of people wandering the wards. So the best advice I could give is to get in touch with whatever your local hospital it is, to get in touch with their medical education department, because I think they are probably the ones who sort of set up work experience. And I don't know if you guys would agree with that, or if you got it through any different routes.
Yeah, I just emailed the local hospital and they allocated me to a ward or a clinic for a week, and I got a week's hospital work experience. But I also, because that took a while to organise and didn't come about straight away, I tried to sort of think outside the box. So I went and volunteered as an activities coordinator at a local nursing home, just so I was kind of spending time and being in that caring role and showing I was committed to something. I think that's important. So it was on a weekly basis for sort of 6 months, a year. And then I also went some experience in a GP surgery. So I went on home visits with the GP, the local care homes, and out at London to see some of the elderly patients.
I think also, just from my experience advising, is try and reach out to friends of parents. You will know doctors in your own network. So perhaps a first port of call is to actually at least have a conversation with them, which then may lead to an opportunity somewhere. I think finally we're going to conclude. What is your final piece of advice to a student potentially who's thinking about studying medicine? What advice would you give them at this stage in their lives?
Okay, so I would say make sure you pick the right A-levels, so you're not narrowing down your options. Try and get some work experience if you can, because then you'll know what you're getting yourself into, but also things you can talk about at interview and mention on your personal statement. And if you're thinking about it, definitely find out more about it, because it's a great career and I love my job and would encourage anyone to go into medicine as well.
I'd say concentrate on making sure you get your grades. So make sure that, if you get that offer, make sure that you're concentrating on your work in A-levels to make sure that you don't slip up and, go under the grades. So make sure you concentrate on that. I think I'd say try and speak to some undergraduates that are in medicine, perhaps in their first, second year, family, friends. Say, what is it like? The other thing is, I would say that you need to persevere. I think that if you don't get in as an undergraduate, there are lots of other routes to getting into medicine. And I have lots of colleagues and friends that have done graduate medicine. They didn't get in, they took a gap year, then they applied again. And don't be disheartened if you don't get in the first time. You know, try again. I absolutely love my job, and I wouldn't want to do any other job in the world.
Guys, I can't think of any better ambassadors for being a doctor. So thank you so much for your time, and I will see you soon. Thank you very much.
Thanks.
Thank you.